The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone, and welcome to the webinar, Financial Considerations, the Top 10 Things to Help with Transplant Finances. My name is Cindy Andrick, and I am the Manager of Family Support at the Children's Cardiomyopathy Foundation. We're thrilled to be partnering with transplant families today in support of National Pediatric Transplant Week. Before we start the webinar, I have a couple of housekeeping items to review. In order to provide the highest quality webinar session and to avoid any background noise, all attendees will be in the listen-only mode during the presentation. If at any time you experience technical issues, please type your concerns into the chat window on your control panel and we'll do our best to address them. If you should have any audio issues or difficulty hearing, you should be able to switch from your computer screen to a call-in phone number to correct the audio. If the control panel is preventing you from seeing the screen, you can hide it by clicking the small orange arrow at the top left of the control panel. Last, we are recording today's webinar presentation and will post it on CCF's YouTube channel called CCF Heart Kids. And now it's my pleasure to introduce you to Melissa McQueen, who is the founder and executive director of Transplant Families. Melissa will introduce our two speakers who are with us today for the webinar. Thanks for your partnership, Melissa, and welcome.
Hi, Cindy, and thank you so much. We always look forward to co-presenting these very informative webinars, and Children's Cardiomyopathy Foundation, we always appreciate you during National Pediatric Transplant Week. Transplant Families was formed and very much inspired by CCF in the hopes to support, educate, and inspire. We do this all for solid organ and bone marrow transplant families. We provide the same support we hope to receive as transplant families ourselves. We are so happy to celebrate National Pediatric Transplant Week. We continue to be proud to work with UCCF and all the supporting organizations, transplant societies, children's hospitals, medical professionals, and many others that make pediatric transplant a much easier journey. Every day after our child's transplant is truly a gift to us, and we thank you for that. Now it is my privilege to introduce President of Children's Organ Transplant Association, Rick Lofgren, and a little later, Transplant Financial Services Supervisor for Phoenix Children's Hospital, Allison Pela. Welcome, Rick, and thank you for joining us today.
Thank you, Melissa, and thank you, Cindy, for allowing us to be here today. I'm going to show my screen here so that you can see what I'm talking about. As Melissa mentioned, my name's Rick Lofgren, and I've had the pleasure of serving as the president of the Children's Organ Transplant Association, or better known as COTA, for the past 21 plus years. And COTA's been working with transplant families, the people, not the organization, for 34 years, and with Transplant Families, the organization, since Melissa founded a number of years ago. I've been good friends with she and Joseph Hillenberg for a number of years. I wanted to talk today a little bit about what COTA does and to explain how we might be able to help your family as you navigate your transplant journey. And I'm going to highlight some basic information, but also want you to know that if you'd like some more information, that you can email me at Rick, that's R-I-C-K, at COTA.org. And I'd be happy to send you information that you might find helpful. And then also during the presentation, you'll see some web links and things that we'll share that will probably be more helpful even than talking to me, because you'll be able to research things at your leisure and when you have time. And if you're like me, it's usually time when you get back with your spouse and talk about some of the things that you feel like you need to get a little more detail about. But just to start, COTA is a national nonprofit organization. We help children and young adults who need a life-saving transplant, and we do that by providing fundraising assistance and family support. What is unique about COTA is that we also can work with adults with single gene diseases, and I realize that doesn't necessarily tie in with the people who are listening today to this webinar, but if you do have these situations with polycystic kidney disease, cystic fibrosis, or any of the sickle cell diseases, we actually can work with patients regardless of their age, and we do have a number of volunteer teams that are raising money for brothers and sisters, sometimes a parent and a child, but we can put together teams that way. But we've been doing this for 34 years and have helped in excess of 3,500 families across the country to get through this process. Now, one of the first questions I always hear from patient families is, how can money be used? what does the money go to? And I would like to walk through some of those specific things. And I know the question and answer session, you'll probably have more specific questions, so please do send those questions in. But probably the place to start that is the best is to say that CODA provides 100% patient benefit. So what that means is money that is raised to help your family is available for your child's lifetime. So expenses that you need not only to get through the transplant in the next month or next several months, but also what are those costs that occur further down the line. And in our 34 years, we've never charged a fee for our services, and we've helped raise in excess of $125 million to help patients along the way. Probably the next most common question that I hear from families is, when should we start? And I have to tell you, I've been doing this for a long time. It is better to start early than late. A lot of our patients start to work with us and begin fundraising when they've been admitted to the hospital. If we could start working with your family earlier in the process, that would allow us to not only get the volunteers trained, perhaps get a pool of funds available so as you start to access it, you have full access to money right away. That really is most helpful. And as an example, for either our kidney or our CF patients that they know the transplant is going to take months, if not years, to reach that point, it's helpful to know that those funds can be used for things like, for kidney patients, dialysis treatments. For CF patients, a lot of the care that's taken place before the transplant actually takes place. All of that to say, we can help patients that are post-transplant, but the general public tends to think of the transplant as being kind of the end of the process, and they don't understand that there's a whole lot more that happens post-transplant. So if you're thinking about what you want to do, whether fundraising is appropriate for you, this is probably the best time to start thinking about that, and that's pre-transplant. Now, to get into some of the very specifics, and if you go to our website, which is cota.org, there's a video link there, and we have videos for families of every type of transplant. So depending on if your child needs a heart transplant or a liver transplant or a kidney transplant, we have videos with families talking specifically about their experience. In fact, Melissa and her family are highlighted as one of our heart transplant families in the videos, but it will give you an idea of what some of our families have experienced and some of the things that they look forward to and some of those expenses that maybe caught them off guard. But as an example of what we pay for, you'll see on the screen some of the obvious things, but just to highlight some things that might not be as obvious, we can help with costs for things like counseling. We have a lot of families that have medical insurance premium assistance, and that's for the patient. Those are transplant-related costs that we would see that are obvious. Co-payments and deductibles seem like one that every family takes advantage of, but medications are also available, and we do have a partnership with Walgreens, and so you can have your Walgreens transplant pharmacy prescriptions billed directly to CODA, so you don't have to pay for it and then request a reimbursement from that. So that's another resource that we provide. We also pay for temporary housing and parking, and I know many families, their transplant takes place in a city that's far enough away from them that they can't go back and forth every day. I know some of our families that have gone from Phoenix to Houston. We have a family we're working with right now that is being transplanted in Utah, but the family is from another state, and transportation and lodging costs are a fairly significant amount of money for them. Then for regular transplant, transportation costs at home, think about all those clinic visits that you go to, all the lab draws that you have, just the normal appointments that are just part of your child's life and the transplant journey. Those are costs that we can help with. And while all that's happening, you'll have meals and incidentals, gas costs, those kind of things. Those are all expenses that CODA can help with. But probably the biggest thing that we pay for, and this is across the board for every type of transplant we work with, are household expenses. And on average, about 65 cents of every dollar that we pay out every year is going to cover things like your mortgage payments, your rent payment, your cell phone bill, your car payment, all of those costs that you have, probably when your income has been decreased the most, while one of your family members is not working, and sometimes it's both parents, that's when we can help out with those household expenses. So as an example, in last year for us, we paid out about $4 million to help our families, and about 65 cents on every dollar that went out the door was, again, for those household expenses and not for those other medical bills that most people think of first. So again, I always try to give concrete examples. Our board chairman, his daughter had a kidney transplant and her older brother was her donor in August of 2018. Rob told me that following some complications that kept his daughter inpatient for about a month, that his family had more than $1,000 in costs just for parking, gas, and food during that 1 month period. About the same time, there was an article in USA Today that said that of those that they surveyed, more than 50% said that an unexpected $1,000 medical expense would devastate the family. I look at this and think about what the costs are for transplant, and I know Allison is going to talk about this a little bit more. $1,000 for our families going through this process is a pretty typical month. It's not a lifetime, it's a month. So what I look at and want to make sure is that you recognize is that we can certainly help your family, but we typically are not raising $1,000 or $2,000. We're raising many tens of thousands of dollars. As an example on the screen, you'll see Melissa Sundillan and another one of our patients from the Phoenix area. Even before the pandemic, CODA was set up to be able to help families raise money online, and you can see in the slide that during that 3-year period from 2017 to 2019, our patient families benefited from more than $7.5 million of online support. So even before the pandemic, we were set up to do this and to help families be successful and volunteer teams to help them. But it really is a great tool to be able to see how we can go about raising money. And I'll just walk through some of those specific resources. So again, on our website, cota.org, we have what we call our transplant expense estimator. A lot of families, when I talk to them about what they have in front of them, they think about what do we need to get to the point of transplant and back home again. And what we try to do at CODA is to help families think a little more long-term. So for instance, a lot of our patients are 10 years, 15 years. The young man in the last photo is 26 years post-transplant. Those families are still accessing funds that were raised in their CODA campaign to be able to pay for those co-payments and deductibles, those lab draws, all of those costs that every family will have throughout this process. But I think this transplant expense estimator will give you a better handle on what those costs might be. And then as you can see on the next screen, there are a lot of bits of information on contacting our families. And if you look at the toolbar right under our logo, you'll see that there are a lot of opportunities to see what other families have done, to learn more about what CODA does, and to connect with other resources that are available. Now, a lot of families that I talk to have already started a GoFundMe account. In fact, more than 50% of the families that I talk to on a daily basis, this is how they started fundraising. The average GoFundMe account, and this was about 2 years ago when we did this research, the medical fundraising campaigns are raising about $2,600, which is a lot of money. However, an average CODA campaign raises about 7 times that amount of $22,000. And those volunteer teams that actually have a group of volunteers and follow some of our step-by-step instructions and implement a whole host of fundraising activities, those teams are actually raising in excess of $35,000. So there's a lot more resources that we bring to the table to help your family, as well as the fact that there's no cost for this. We provide all of our services at no cost. Online gifts, we absorb the merchant fees for those gifts. So it really is a great benefit and resource for your family. Now, I always highlight different patients to give you an example of what we do. The screen that you have in front of you now is for one of our patients that had a bone marrow transplant at Phoenix Children's Hospital. And this volunteer team raised almost all of the money that you see here on the thermometer of over $27,000, but almost all of that was raised online. They did a couple of face-to-face events, but almost everything was done by sharing the information on social media. They did a great job on Facebook and Instagram both, but this is a great resource to, especially this time we're dealing with today, to utilize some of the resources that CODA provides that allow you to raise money without having face-to-face contact. You probably know, especially if you're a kidney family, that March was National Kidney Month, and this is one of the resources that we provide, an example of something that one of our families and their volunteer team was able to do to share their story on Facebook. I always tell the story of the number of people that have hundreds and sometimes thousands of likes on their Facebook posts, but that really doesn't help you if those likes don't translate into either volunteer hours or donations and contributions to help your family. So this is a great way to look at some of the resources that we bring to bear. Again, during the pandemic, there are a lot of things that you can't do, but there's still many things that are very successful. The Adopt Envelope fundraiser is a great example of that. If you think about something very similar and very simple, buying a box of envelopes and writing the numbers 1 through 100 on them, if you were to do a fundraiser either face-to-face or online, as this example is showing, if you can get 100 people or 50 people to take 2 as an example, that would raise $5,000. And so these are the kind of things that we provide, and we have many of these options. Events that take place online. We have a number of auction options, and we really do provide step-by-step instructions to help your volunteer teams be successful so that you as the parent can focus on making sure your child has everything that they need from a health standpoint. Now, to get the whole process started, we've created a new program called Get Started. If you go to our website, again, it's cota.org. You'll find the link, and you'll see in the screen here, the blue arrow is pointing to that link. This will take you to some of the basic information on how to become a COTA family. So as an example, the Transplant Expense Estimator is on this page. The yellow button in the middle of the screen that says Get Started Today will allow you to contact our office and get some additional information. One of our staff members will give you a call back, and most likely that will be Sherry. I always comment that Sherry is the person that if you're having a bad day, you want to talk to, because Sherry has the right temperament and the right voice to walk through any process. And as a mom, she knows how to do that very well and can help you not only understand what we do, but show you some of the things that we can do and examples of how we help families. And then again, I mentioned earlier the videos we have. The family that's toward the bottom of the page is one of our Phoenix families that the transplant actually took place at Lucille Packard Children's Hospital in California. But Elijah's volunteer team raised in excess of $60,000, and they had one of those non-traditional campaigns as well. And his transplant took place in another state. So great opportunity to take a look at what are some of those other options that we provide and some resources that are available on our website. Now, one of the most common questions that I get once we get to this stage of the process with COTA is, how do I get someone to help, or what kind of person do I need to ask to help? To get started, we just literally need a single person to start. Oftentimes that's a family member or a friend, someone from your church or synagogue, someone within your social network that cares about you and is willing to help. We'll give them all the training they need. We'll show them how to find additional volunteer resources, but getting that one person to start the process is all it takes to get moving forward. So if you can work with us to do that, we're very happy to help and make sure that your volunteer team is successful. And we'll give you all kinds of resources that will help not only with fundraising, but working with the media, working on social media, and sharing your story. We've had a number of families that have used the Facebook platform specifically to recruit a kidney donor as an example. And we've got some resources that will help with that as well. So I know that's a lot of detail in a short period of time. I know there's a question and answer period, but I want to again say thank you and to encourage you to work with resources that are out there to help. Allison's going to talk more about what are the expenses that a transplant financial coordinator has. Melissa can talk at length about what are some of the emotional resources that transplant families can help with. But please know that COTA is here to help your family to make sure that the financial piece of this is not an additional stressor on you as you're going through all the medical issues that you have to face. So I will stop there and be happy to answer any questions. And again, Cindy, thank you for inviting us to join you today.
Oh, thank you, Rick. That was really informative. So I'm going to turn things over to Allison at this point, and we will hold all questions until the end. So Allison.
Yes, all right, let me get set up here. Okay, so can everybody see what my screen is.
I am not seeing your screen.
Uh-oh.
I see it.
Oh, you see it?
You
Okay.
see it?
Yes.
Okay, great.
Okay, maybe there's a little bit of a lag. Okay, so hello, transplant families. My name is Allison Pela. I am the supervisor of Transplant Financial Services at Phoenix Children's Hospital. So some of the information we're going to go over today kind of applies to all transplants, solid organ, including and then bone marrow in addition. So, but all of it can be beneficial to everybody, regardless. So let's get going. So we're going to go over what the role of the Transplant Financial Coordinator is. I think sometimes we get a bad rap because nobody's quite sure what we do and what we're there for. So I want to clue you in and show you how that we can be helpful in your journey. Okay, so what does a TFC do? And when I say TFC, that's just short for Transplant Financial Coordinator. A TFC's role is kind of multi-pronged. Really, we work with the families, we work with the insurance companies, and we work with the clinical staff. So when we first get the referral packet that's sent over to the clinical team, when a patient is referred for transplant, the first thing we do is that we will look to make sure that that patient has insurance benefits that will cover transplants. Because before we get going, we just want to make sure that everything's going to be covered and that we're not going down a road that's going to financially devastate anybody. The next thing we do is we look at if there are any financial barriers to transplant. So the main thing that refers to is that if you have a high deductible and or a high out-of-pocket cost that has not been met, what's that going to mean? Is that going to be a barrier? For some families, that's not a barrier. For other families, that is. So we want to assess that, and that doesn't necessarily rule anybody out, but we want to know up front so we can start working on resources. We also meet with all of our transplant families. And for solid organ, that is a requirement of UNOS, is that there is a TFC in place as part of the transplant team, and that we do meet with all referred families. So we will meet with a family and we'll go over the insurance benefits. Typically, the transplant benefits are applied, or they apply to the regular insurance benefits. So what that kind of means is that if you have a $500 deductible and a $2,500 out-of-pocket max on your regular medical plan, your transplant cost will apply to that as well. You don't typically have a separate deductible and a separate out-of-pocket, which is good news because if you are in the transplant journey, chances are you've already met a lot of those out-of-pocket costs, and so you don't have to start over until your plan year starts over. So we will meet with the families and kind of give them a kind of snapshot of what to expect financially, how much is remaining on your out-of-pocket, what it's going to look like if you receive your transplant in that plan benefit year. Next is that we do act as a liaison between the clinical team and the insurance. So we just want to make sure that everything is authorized and that the insurance is aware of what we need to do clinically and that they approve it. And B, we want to make sure that the clinical team is aware of any restrictions that the insurance may put in place so that everybody's on the same page, which typically doesn't happen, but it's good to know. And that sometimes usually only occurs with maybe like living donor workups. They can only look at a certain number of living donors, or for bone marrow transplant, we can only test so many possible donors. But it's pretty rare. The next thing we do is that we work pretty closely with social workers. And so all the transplant families have a social worker assigned to them. And we work in conjunction to help find any resources that family may need. Of course, a social worker does more than just financial resources. They have a whole slew of resources at their fingertips. But if there's financial concerns, we work together to try to fill that gap. Another thing that we do, and I think that sometimes it gets forgotten, but it can be very helpful, is that we are the point of contact for families for all billing and financial questions. So leading up to transplant, we're pretty involved, and there's not really a lot of billing questions up to that point because we're just getting going in the process. But after the fact, when the bills start rolling in, sometimes there's a lot of questions or concerns, and we can be your main point of contact. So if you get an EOB in the mail or a bill and you just want to make sure it looks right, you bring it to your TFC. They are happy to research that for you. They can be your one-stop shop for all of those questions. I think what typically keeps people from reaching out to us is that they're afraid that we're going to want money, and that is not the TFC's role. We typically do not collect payment for transplant services. In my 10 years of experience, I've only had to do that one time, and that was just so that I was the one person dealing with the family because we had a long relationship, but that is not our job. We don't want to collect money from the families. We want to help you get resources in place if you need help with that, but that is not our job. So please don't ever be afraid to communicate with your TFC about any concerns or questions that you may have. We do assist a family with locating resources to aid with the financial obligations. So like I said, if you have a large out-of-pocket, most families don't have that money just on hand to pay it, and it can be scary, and sometimes people are afraid to speak up, but please do not be afraid to speak up. Do not be afraid to ask for help. The TFCs and the social workers have so many resources available to them that they are more than happy to help you get in touch with. So our first organization that we work with, and kind of our go-to that we tell all our families to reach out to, is CODA, which Rick just talked about. They are a fantastic organization, and we advise all of our families to set up a CODA fund, regardless of whatever their financial situation may be. It's never a bad idea. We also work directly with the different departments within a hospital. So there's usually a department that's responsible for setting up payment plans, and a billing department, and a department that helps families, if you haven't already applied for Medicaid, or in our state, it's called Access. So a little bit about ESRD. So this slide has a lot of information, so I'm not going to go over all of it, but I just wanted this on here in case you want to go back and look at it later. We encourage all kidney families with ESRD to apply for Medicare, even if you are currently covered by a commercial insurance or Medicaid. And in the next slide, I'll go over the reason why. It may not be something that seems important today, especially if you have a little one. You're thinking, well, Medicare's for old people, but that is not the case. There are a lot of really great benefits to at least exploring that option. So let's just go over the highlights. When you apply for Medicare and you are on Medicare during the transplant evaluation phase of care, so for instance, let's say you have United Healthcare as your primary, and you do qualify for Medicare under ESRD, which is end-stage renal disease. So Medicare would be your secondary payer. The Medicare rules say that all transplant evaluation services do not get billed to the insurance, and we absorb those costs and we report them to Medicare and we get reimbursed separately. But what that means to you is that it won't get applied to your deductible or out of pocket, so you can avoid some extra costs on that part. The other really cool thing that I think a lot of people don't realize is that if a recipient has Medicare at the time of transplant and they have a living donor, that donor will be covered by Medicare for all donor-related complications for the rest of their life, which is amazing because no Medicaid or commercial coverage will ever offer that. I have not seen it offered. Who knows what the future holds, but I don't anticipate that. So, I mean, of course, nobody wants there to be donor-related complications, and thankfully they are somewhat rare. But it's nice to know that if you have a family member or a friend that steps up and says, yes, I will be your donor, and you have Medicare, that donor never has to worry about any cost related to complications to their donation. And then last is that having Medicare in place at the time of transplant allows the recipient's immunosuppression drugs to be covered under the Part B benefits. And I believe it's for 36 months post-transplant. So again, even if Medicare is your secondary and you have commercial insurance as your primary, those immunosuppression drugs can be very expensive. And Medicare Part B will pick up the cost of those. So that is a huge benefit. Okay, so enough of Medicare. So let's talk about what TFCs can do for you. Kind of in a nutshell, what we've gone over is that a TFC's job is to help the transplant families ensure that the transplant journey is financially secure. Like I said before, we don't ever want anybody to be financially devastated because of a life-saving transplant. Our goal is to help families get through this as financially secure as possible. The things that we tell our families when we meet with them is, most importantly, maintain insurance coverage. It is so vitally important. Now, we know that things do happen, things occur, and unfortunate circumstances go on. And if that does happen, please reach out to your TFC as soon as possible. Let them help you. Give them a heads up. Unfortunately, if coverage is lost during the transplant journey, everything will come to a screeching halt until we secure additional coverage in place, and we don't want to lose time. I cannot stress it enough. It is so important to have a good relationship with your TFC and keep them informed of any insurance changes so that they can help you. Like I said, do not change or cancel your insurance without talking to them. Even if you say, oh, well, my employer's changing insurance, at the first of the year, and it's going to go seamlessly, let your TFC know ahead of time, because sometimes those insurance plans might have a different network where the facility that you're set up to get a transplant may be out of network, which isn't always a hard stop. Sometimes we can work with insurance companies, say, hey, they're already listed here for transplants. Can we get an agreement in place so they can stay here? It's just best that we know about these things as soon as possible so that we can make everything seamless. And maintain open communication with your TFC. Utilize them as a resource. They are there to help you. They are there to be your friend. They are there to be a resource for you, and they will do everything they can to advocate on your behalf. All right, and that wraps it up.
Okay, thank you. So we do have a couple of questions, and these were written as you were presenting or before you presented, so you might have answered some of these things already, but I'll just throw this out to both you, Allison, and Rick, whoever wants to jump in. So someone just asked a question about what you just addressed. They said, what do you suggest if a family has a job loss and their primary medical insurance coverage terminates?
So I recommend reaching out to their TFC. So at Phoenix Children's, and it's pretty similar at most hospitals, we have a department, ours is called Patient Access and Financial Services, that can help you apply for state Medicaid. They can also kind of explore other options. If you don't qualify for Medicaid, we can look at marketplace plans to see if you qualify for any of those. We can help you do all of that.
Okay, great. Thank you. What resources do you have or suggest for out-of-pocket costs for things like copays for medications?
Yes. So our go-to, as I said, is CODA, because they are fantastic. If you're early on in that journey and you just haven't raised enough money yet, or your costs are exceeding how much you've raised, We also work with the social workers, and we can work with the drug companies. Sometimes there's a discount card available. It really kind of depends on the scenario. If it's drug specific, we can look at down that avenue. If it's just like, out-of-pocket costs for clinic visits and lab draws and typical bills, we can work with the team at the hospital to help set up payment plans if that's kind of the road we need to go down.
Okay, great.
And Cindy, just to jump in and echo what Allison said, one of the things that we can pay for are those costs. And for families where someone's been laid off or displaced for whatever reason, we can help with household expenses. So as an example, most of our families come to us and have expenses that they've already paid for. We can help reimburse them for some of those costs that they had already incurred, whether that was emptying out their savings account or using all their paid time off. Those are things that we can work with families, and we encourage people to contact us just to walk through what some of those options might be.
Okay, great, thank you. And then this is the last question, and this is towards Rick. What is the typical size of a volunteer team that a CODA family usually has?
That's a hard question to answer. It could be one person, it could be 100 people. Typically, to get started, we only need one person to get the ball rolling, but the more volunteers you have, the more options that we have. As an example, if someone wanted to do something online, a single volunteer can do that. That's something that's very simple. But if you want to do an event that requires a lot of people, and obviously those are a little more limited right now, but in normal times, and what we hope will be sometime later this summer, putting together an event at your local church, maybe something at your child's school, perhaps something a little bit bigger like a golf outing, that takes more volunteers to organize. But what we'll do is work with that first volunteer to help set up what are those groups that you'd like to tie into. So for instance, a local community foundation, we can help them do that. If they want to do some online fundraising, we can give them some tips and tools and resources that have been very successful. So those kind of things are easy to do with one person. Restaurant nights are another example. But those events that actually take multiple people to set up, that probably does require additional volunteers just for the setup. But actually the day of an event like that, you need more volunteers. So what we try to do is help volunteers identify, if you have 5 people, here are the kind of activities and events that really work for that size group. If you have 25 people, you can move into this area. And if you have even a larger group, or maybe your church family takes part in this, here's an event that might take 30 or 40 people to do, and it's over a multiple week period. We can show people how to do that, but we'll help direct them to what activities that really match up well with the size of group that they have.
Okay, great. Thank you so much. I really want to thank both of you today for giving your time and expertise to share with us this information. It's been extremely helpful, and I want to thank you for being part of this today. I do want to just point out a couple of things. Today's webinar will be available on our CCF YouTube channel called CCF Heart Kids. I've put up on the screen our CCF and Transplant Families websites if you want to refer for any other information. And also, I just want to let you know that CCF and Transplant Families will be partnering again tomorrow for another webinar called Educational Considerations for Your Child, IEP and 504 Information for Every Transplant Family. If you want to register for that webinar, you just need to go to the Transplant Families website and you can register through there. So I want to thank everybody for being with us today. Melissa,
Gina?
did you have any?
Sorry.
It's okay. Melissa, did you have any comments or anything that you wanted to add?
I do, and I was just kind of inspired by both Rick and Allison, and I wanted to tell anyone that's listening out there right now live or to the recording later that, don't, as a transplant family ourselves, don't be ashamed. No one has $1 million to pay for medical bills. It's really, really expensive. And some of the horror stories that you see in the adult transplant world of denial happening for funds for their transplant. That doesn't happen in the pediatric world. These transplant financial coordinators are miracle workers. They are definitely your financial advocates. They find ways to get your money for the transplant because they want to see your child's life saved. Everyone is there for you and they want to help. And, you know, they have so many avenues to get that money so that your child will have that life-saving transplant. I know that when we started our transplant journey with our son Dylan, we thought for sure we would have to declare bankruptcy, and the medical debt was just crushing. But thanks to our hospitals and organizations like CODA, we never had to claim bankruptcy. We had it all covered. They just find ways to make that happen, even after everything you go through. So definitely lean on them. They're there for you. They're there to help. And I also want to encourage everyone to both on the waiting list and after you've received your gift, to definitely check out our websites, our webinar tomorrow for early intervention. There's a lot of great information there, and to share your story with the hashtag Kids Transplant Week. It sticks with people when you tell your story and they remember it. If they're ever in a position to give, they remember our pediatric stories, and then it inclines to help them give it in those complicated situations. I want to thank you all, the families, for your strength and resolution, all you do to fight for your kids before and after transplant. And I want to thank you, Cindy, for co-presenting again with us today. This is just an amazing opportunity.
Thank you. And thank you all for being with us today. We really appreciate it and learned a lot. So thank you. Have a great day, everyone.
Thank you very much.
Thank you.